That's impressive.
Okay, so we should be live now. So welcome everybody who is watching. Just in these first few moments, we're going to make sure everything is functioning right. So please let us know where you're watching from. Let us know if you can hear us, if there's any issues with the sound, any lagging.
Okay.
We're going to start with just a bit of an introduction. So,
Liza, how can we tell if people are on and it works? Is there a chat thing
well, I
there?
can actually see us live on our YouTube channel.
Oh, you can.
So that part is working correctly, and we're going to make sure that we're live through Dr. Laurie's channel as well. And we have another team member, Christine, who is helping us.
Okay.
So hopefully things are functioning properly. I'm not quite sure though, but
it is, because I can tell you, because there's a little button that says chat, and I've got Deborah Smith who said hello from Louisiana.
perfect.
Oh, perfect.
That's good. Look forward to watching. Christine,
Okay. Oh, I see.
on here. Yay!
Yay. Okay. Somebody's from the Yukon. We're from like all ends of the North America right now. We have Louisiana and we have the Yukon. And we have the Philippines and we have the Netherlands.
Wow.
Okay. And
Awesome.
that's awesome.
Yeah, that is.
Okay.
Actually
And we have North Carolina.
Yeah,
and
North Carolina. Woo, woo.
You're North Carolina. There you go. And we have North Carolina. And we have Western Canada. Okay. We're from everywhere.
Very cool.
Okay, awesome.
Okay.
I just want to double check that we are hopefully live through Dr. Laurie's channel, but doesn't actually appear that we are. So
Okay.
Not
Florida, Pittsburgh, Ohio, Michigan, Washington State.
You guys are from everywhere. Oh, awesome. Okay, good. And there's lots of good information coming today.
Yes. Alex from New Zealand. Awesome.
Yeah, that's awesome. Okay, you guys are from everywhere. Liza, does it seem to be working, Liza? You're saying it's on our channel.
It's on our channel working properly. We have everyone who is here watching currently. I'm not quite sure if it's actually going through Dr. Laura's channel, but I think we should just move forward with the live stream and hopefully things go well. And otherwise, we'll figure out the other stuff afterwards. Yeah, yeah. Well, we got a few kinks we still have to work out with this, but just to get this going, just to let everyone know who is watching, I'm going to start with just a brief introduction of a guest who is on our channel. And the way that these streams usually work is we'll do this introduction. The two guests, Dr. Jones and Dr. Laurie, will be talking for most of it, and I'll be on a side part. And then at the end, in about 50 minutes or so, we'll do a Q&A. So if you have questions while they're talking, please put them in the chat. I'm going to be trying to write them down as I see them, and please keep them related to the topic that they're talking about. And then in the 50 minutes for our Q&A, I'm going to try and ask them as many as I can, and we'll do about 10 minutes or so of Q&A, and we'll go from there. So to start, Dr. Laurie, thank you for joining us today. I have a bit of a bio that I put together from the information I found on the internet, so correct me if anything's wrong, but Dr. Laurie McCauley is a pioneering veterinarian with a lifelong passion for helping pets achieve an optimum quality of life. A graduate of Colorado State University School of Veterinary Medicine, she opened the first veterinary rehabilitation clinic in 1998, designed the first underwater treadmill for dogs, and has taught thousands worldwide through her 14 years on faculty at the Canine Rehabilitation Institute. She is board certified in canine sports medicine and rehabilitation, certified in acupuncture and chiropractic therapy, and is the founder of Red Tail Rehab and Optimum Pet Vitality. That's my bio.
Yes, awesome. Good job. Yay.
Yay.
Thank you. Okay, so I'll let you two just...
Do I get it? Do I get an intro?
Well, I think everyone knows Dr. Jones, considering they are on your channel. So
okay, perfect. Okay.
You are. But right. I'm going to move you two to be the main screen, and I'll be on the side. And I will come back in about, oh my gosh, who is...
That's Sid. Sid, say hi.
Sid. He's an awesome dog. He's in all of the videos.
He's one of very few dogs in the world that can actually jump on a round exercise ball and walk it forward, backwards, sideways, and do spin and twirl with nobody touching it. He's awesome.
He's a rehab king too. Wow, that's like physio.
That's
Yep.
impressive.
Super strong.
Okay.
Okay.
So this is awesome. Okay. So apparently you guys all know me, Dr. Jones. Really happy to have Dr. McCauley on. She has done a bunch of things, as you've heard. Like, she's got this huge, extensive history in teaching like veterinarians and vet technicians and like pet parents, like how to use all these array of different healing therapies. But we're talking about the tuning fork today, and she's got a really good course with I just finished going through yesterday, and I learned a bunch of stuff. I got a couple pages of notes. So I'm pretty excited, and it's things I think are really applicable that use as a pet parent can be using with your dog, potentially with your cat.
Mm-hmm.
But that we need to talk. You're the smart one.
Okay, I'm gonna move you to be the main screen, and I will come back in about 15 minutes.
Okay,
so
all right.
Have fun.
Thanks, moderator Eliza.
Thank you. Awesome. Yeah, so we've got the tuning forks. You went through the course, and if I remember, I met you at Super Zoo, Andrew. Do you want me to call you Dr. Jones or?
No, Andrew's good.
Okay, I'm Laurie, right?
Yeah, yes.
I met you at Super Zoo, and I put the tuning fork on you, and you're like, "Wow, that's kind of crazy."
Yes.
And it's an amazing tool. Tuning forks have been around since, oh my God, the 1920s, used originally for checking for hearing, and then for if there's fractures. They don't do that anymore. I don't know if when you were a kid, they would do that. Be like, okay, there's an x-ray and an injury. Is it fractured? We can't tell. And they put the tuning fork on. And if the patient screamed, they knew, yeah, there's a fracture, because the bones would oscillate at different rates and cause a lot of pain. They would probably do that now.
Because you talked about that in your course. You mentioned that in one of the little sections, how it was used diagnostically. But wow.
Yeah. And now we're using it. I've been teaching the tuning fork for pain and inflammation and lymphatic drainage in VIN. VIN is Veterinary Information Network. I've been teaching that part of their pain management course, obviously that non-pharmacological section of it. And it's amazing what we're seeing with it.
Okay, so that's impressive. I actually took some courses on VIN. I mean, it's a bunch of conventional ones, and then I think I did Introduction to Herbal Medicine way back when, with just that alone. So that's just for those of you guys watching. It's just a group of veterinarians who are a little bit more specialized, that are teaching mostly veterinarians, like advancing your skills. Or it's just a really good way to learn a whole bunch of information. You're getting really smart people. So it's even great we have you on today. So first of all, you were saying, like, I didn't realize. So first, the tuning forks, I didn't realize they've been around that long. Like, I didn't know, almost over 100 years of use. And when you first see it, and before I was introduced to it, I'm like, maybe a little bit skeptical. Is this really going to do anything? But apparently, and it does. Okay.
Yes. Yeah. So the first thing I did with you is I had you listen to it, and this frequency of 128 hertz. So do you want to listen to it now and see if you feel it? Just activating it and putting it by your ear.
Yeah. Oh yeah, and here. Oh, it's my cat who's about to. Cheapers. Sorry. You are a pest.
Well, you can play by your cat. Hi, sweetheart.
Oh, yes, he's like crawling on the keyboard, and look at you. Yeah. Okay, you down. He wants attention.
Yeah. Well, and you can. All right. So if you listen to it, it turns on your parasympathetic nervous system. So I know you're a guy, but for women, when we hit 40 or 50 and we go into perimenopause or something, or we wake up at like 4 a.m. and our brain is just going, this literally shuts off the default mode network, which is the part of the brain that does the chatter and helps you go back to sleep. So there's that. You can activate it, and in a human, you can put it on the top of your head. And if you do that, so try it.
Which I did right on. You said, I think there's an acupressure point there. You said, I think, isn't that GB20? I think you said.
Yeah. So from the front of your ear straight up on the center.
And that's the same thing in like if I was to grab my cat.
But
He
usually
his
animals don't like it on the head if it's straight.
no,
Sit, come here.
would be right
So,
there.
like, if you're going to do it on a cat or a dog, activate it, put your whole hand on their head, and then put it on your hand. So it makes it diffuse. And they're
Oh,
like,
okay.
oh, I like that.
Okay. So, Laurie, so when in starting out, so your biggest thing you're teaching, because you've got this big course, so it's primarily geared towards obviously pet parents that are obviously more open to alternative, but they medicine, but they also want to be involved with
Yes.
better caring for their pets. And is it mostly, are most people wanting to take it because of helping to manage pain, or is it like inflammation or anxiety or
Yes,
what?
yes, 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 yes. So, like,
Okay.
I just had you listen to it, right? You
Yeah.
can imagine if you had a fractious cat or a scared cat, just
Yeah.
activating it and holding it close to the cat or dog helps them relax.
This would. Oh, that
Yeah.
would have been so helpful. And
Yeah. When you have like a
practice.
cat that's just nervous, just activating it and having it in the room for a couple minutes
Oh,
because they're
really?
so um, sensitive to the energy, they totally relax. I have
Okay, so it just
patients.
has to be in the area. Oh, really?
Yep, yep. Yeah, okay, so you want to try something fun?
Sure. Oh, yeah.
Take that and put it close to your heart, or actually even try it over your head. Can you feel it? Even though it's not. So turn it 90 degrees so it's this way.
Right. This. You want it this way?
I want it.
You want it this way? You want it
Yes,
this way?
yes, yep. Right? Yes,
Or,
that feels better. And then just put it over your crown. Can you feel it in your head?
oh, yeah. There's a little
Even
bit of
though
a,
it's not touching you,
yeah,
right?
there's a little bit of a funny throb just at the back of the head there. Yeah. Huh. And so you would say this way, not because often on the
So
animals you were using it.
this way is to hear it, right? So you aim a
Okay.
little hole into your ear and you'll
Yeah.
hear it better than if you do this. But frequently when we're in the field, we want to be parallel to the body.
Okay. Okay. So that's the easy. So to start, so be primarily, I've got a, just like you said, just an anxious animal, period, or someone who knows for whatever reason I need to maybe trim my last. Actually, my current cat is horrible to trim his nails,
Yep.
and my last dog, little Tula, she really had a fair amount of anxiety. Just being on an exam table was really not her favorite thing.
Uh-huh.
So that would have been really helpful, as opposed to giving her some type of sedative or something.
Right.
Um,
Right. Yep.
so
Um,
your dog Sid is seemingly unanxious.
no, he's awesome. He comes with me to work. He plays with the animals. He's so appropriate, so good.
Oh, and what is he? Is he like a PD
He's
cross something? Something? Or...
I would guess he's a Feist or a Carolina Mountain Dog,
Oh, right, you
because
guys have different. Oh, okay.
but he's it was from the Cashier Highland Humane Society,
Oh,
and he
perfect.
sees a squirrel and he screams. And I jokingly said, "That's my kind of dog, right? A lot of
Oh,
energy and excitement."
yeah.
And
How
he ended up
awesome.
home with me, and the
Oh,
best decision I ever made.
oh, because he's so good.
He's
Yeah,
so good.
it's hard. It is hard because I've done lots of different video stuff using my own dog and then other dogs I've had and
Uh-huh.
neighbors' dogs, and they're not. There might be they're pretty good dogs, but as soon as you put them on their back or their side, and you're, as you know, yeah. But he
Yeah.
was great to demonstrate all the different things.
Oh,
Wow.
he's so good. He's so good. All right, can you get
So
off my
where would you suggest? So you
so
initially when I was starting through your course, like you did sort of a basic introduction to what is a tuning fork, how to hold it, how to activate it, which was interesting because I
uh-huh.
realized before I did your course, I'm like, well, how hard can this be? But I was hanging on to this
Yeah,
part, and my piece stops vibrating,
soft.
obviously. Yeah.
And you have to make sure you're not holding it tight, right? Because a lot of times people hold it tight because they're concentrating, and that cramps the hand and it dampens
Ah,
it really quick.
okay. And then for activating it, you were saying either just the palm of your hand usually, or is that
So this part, so not
yeah,
here, it's too soft, not here, it's too soft, but the heel part of your hand. And honestly,
yeah.
when I'm at work, I'm sitting on the floor with the dogs and they're between my legs. And I will just use the top of my shoe.
Sure. And that,
Because
I saw you do that. Okay.
yeah.
Yeah. That's a
And
good
then
idea.
well,
And are you using this regularly? Like, is this something you
almost
daily
every
use?
patient. Yes.
How's every patient?
Almost
Oh,
every
wow.
patient.
So it's really therapeutic. Like, if you're using it that much, so you did all that years of rehab training. So, because you said you graduated in 92, you probably worked in general practice
6 years.
and
And
probably
I got
was
bored, fell down
decided
the
that
stairs.
spay and neuter probably wasn't your thing and decided you want to do more than vaccinate and spay and neuter. So you went to specialize, right? Okay.
So imagine this. My first year out, I did a diaphragmatic hernia. I took out a tumor from a Anatolian dog that was like this big. I had a great career, and I still got bored. It was still it went from like, oh my god, this is so cool, to one cool case a day, to one cool case a week, to one cool case a month, to
Right. All
it
right.
was a challenge,
Yes.
right? Yeah. And then
Mhm.
I fell down the stairs with my dogs putting them out at 3 o'clock in the morning. I hurt
No,
my
you
back.
really did.
Oh, I did. I did. I went to a chiropractor. He couldn't fix me. He sent me to a surgeon who sent me to a physical therapist. And I went, oh my God, you mean you can fix this stuff and then strengthen it so it doesn't happen again? All we do is give drugs. And then from there, I started the first rehab clinic, designed the first underwater treadmill, went to the first symposium on sports medicine and rehab. Actually, at that time, it was called physical therapy, which you're not allowed to do. And presented information on the underwater treadmill. And then from there, spent the next 14 years teaching the rehab certification course, one of the main instructors. And yeah, so I got to write textbook chapters, and I love teaching. I just came back from my lecture at VMX and then Minnesota VMA. And in a
Wow.
couple weeks, I go to the Ohio VMA. I love, love, love to teach.
That's awesome. See it. And that's great. You're kind of a rare person in there. That's awesome, though, that you do it. And I'm sure all of the students are pretty excited to have someone who's excited about teaching. And
Yeah.
and then is it because even when I was we're in school at the same time, there wasn't a
Yes.
whole lot of talk around anything rehabilitation wise. It was just
No.
your dog has an ACL injury, you're going to do surgery, and
Drugs.
even then there was just drugs and extensive periods of confinement and
Right. Cage rest. Horrible. Cage rest. Horrible.
yeah,
Right.
horrible.
If you had a cruciate surgery, if you had heart surgery, they would get you up and walking the same day.
The
Right.
same day?
Same day.
The same.
Oh, absolutely. Right.
Wow.
Motion is lotion. You got to get that blood flowing. You want to be able to clear the liver. Yeah. Yeah.
Okay, the same day. So even now, say a dog post like you had an a cruciate repair,
Yep.
you've done surgery, you would say the next day. Wow.
Nope. Same day. So the same
Same
day,
day.
you can be doing icing. You can be doing gentle range of motion. So there's, when you talk about range of motion and joint mobilization, there's 4 stages. Stage 1 and stage 2 is just for pain. Stage 3 and 4 is to increase range of motion. So you could be doing very gentle motion at the joints to stop pain, right? So
Oh, just to produce some
feel
joint
good.
pain. Okay, right.
Yeah, yeah,
Really?
and
Okay.
yeah,
I would have been one who did multiple cruciate repairs, and we didn't do a lot of post-op therapy, which obviously we should have. And okay. And is it now true? And obviously things have changed as I've left practice. But is it now? When I was reading, they're saying in lots the example they used in human medicine that the post-op care, like what you do rehab-wise, is as important, if not often more important than the surgery. Is that kind of a thing
well,
now? Is that
I would love to say that. And is there any
no?
research on that? You can't,
No.
right? You can't
True.
really say
Okay.
that. But is it important? Absolutely. Well, and think about this. Cruciate surgery now is $5,000 to $7,000. I was just talking to someone in New York who there's a surgeon in their area. It's $10,000 for one side.
Here it is too. Here it is too.
Yeah.
Yeah, in some areas here, I talked to someone who had a referral.
And
That
there's
was
a 50% chance without rehab of them having to blow the second one in the next 2 years. So doing the rehab, I had a surgeon friend who just retrospective study. Here are my clients who chose rehab. Here are my clients who chose not to do rehab. No rehab, 50% recurrence. Rehab, 17% recurrence. Right?
That's really
huge. And that was 15 years ago. Right?
Right.
So now what we do so much more for these guys with laser and PEMF and underwater treadmill and gentle exercises and massage and stretching and all of this stuff, we have a much better chance of preventing that second one. And actually, I just gave 2 lectures at the last conference with TPLO on how to prevent the first one and finding the inflammatory signs early so that you don't have the cruciate injury or the rupture.
Really?
Yeah.
Okay, so you're actually working on those muscles and connecting ligament and tissue. Okay.
You can identify the inflammation and the stifle. So when we graduated, a dog would jump up in the air, twist, land wrong, and tear their cruciate.
Yeah.
Now they're running across the yard, scream and pick it up because it's not a traumatic injury anymore. It's a chronic inflammatory issue. So, I mean, there's so many things to go to, right? Early spay and neuter, obesity, but you find the inflammation and you get rid of the inflammation. And it's the inflammation in the joint because the cruciate ligament sits in the joint. So the inflammatory mediators and all of those degradative enzymes are chewing away at the ligament. And it's like pop, 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 right?
Okay, so I could use this then on my dog.
To decrease inflammation. Now, if I only have one modality, I would pick laser. Right?
Oh, you would? Okay.
Laser has been shown to shut the cells that create the inflammatory mediators, shut them down. Laser's also been shown to turn the chondrocytes on to make more matrix, so it can make more cartilage. Right?
Okay. And you have a course. And you have a course. Even you have a course for like pet parents too.
Yes. Yeah. We have
laser therapy. I saw that. Yeah.
Yeah. We have a pet parent course on how to laser their dog, the hows and whys. And also we have a 20-hour race approved course for professionals that teaches them everything they need to know to have amazing results. So pro placement and patient placement, right? So it's not just, the dog's sitting there, I'm going to do it. But when do you flex the joint? When do you extend the joint? How do you go around the joint? What's the important structures to get? Yeah.
Okay. So back into this, and I'm just getting sidebarred. Okay, so I've got this. We're saying like anyone can purchase one of these. And you talked about specifics about the quality, about the weight, about the crystal that's on the end. That's important. I should let you talk.
So 128 hertz is the frequency of fascia, right? So when we say, okay, we want to clear the fascia line.
And what is fascia?
Okay. I know fascia too, right? Yeah. So fascia is, if you think about it, if you've ever made a Thanksgiving turkey and you say, okay, I'm going to take my butter and my herbs and I'm going to put them between the skin and the body wall, that's soft fascia, right? So that's if you cut open a steak and you say there's grizzle, that's dense fascia. So fascia is literally around every single cell in the body. And there's electron microscopy that shows that it actually goes and touches the nucleus of every cell. And it's one big thing that's totally connected. So it touches the nucleus. It touches the nucleus. Yeah. There's studies like with acupuncture that when you put the needle in and twist it, you're twisting the fascia, which makes sense because if you turn the needle clockwise, you get a different reaction than if you turn it counterclockwise. It's which way are you twisting the fascia? And it makes sense that if I do something here on my shoulder, it can have an effect on my foot or down on my fingers or vice versa. So fun things.
It's connected.
It's all connected. So I can go here on my chest and you can't see my hand, but I can actually put it on my pectorals. And if there's fascial restrictions, just doing that, I'll be able to take my arm out further. Right? There's fascial lines. There's so much fun stuff. But
so that's why you want the hertz. So the hertz is the frequency it vibrates at. So you want that frequency because you think that's going to be the most beneficial for treating. Well, that's what you're using treating dogs and cats.
Yes. Well, and because fascia wraps around every muscle, every tendon, every ligament. When there's fascia is responsible for up to 40% of the strength of a muscle contraction. So if the fascia is what we call sticky icky, then the muscle can't contract all the way and it can't relax all the way, right? And if your muscle can't contract and relax, then it's going to not be able to strengthen as much or as fast. So if you
Wow.
Yeah, and there's like little lymphatics, right? So fascia, when it gets tight, so think about it's around every cell. So every cell uses energy and it creates metabolic waste and toxins. That goes through the fascia into the lymph nodes, which then go through the lymphatic ducts, which then come out through the thoracic duct and the terminal duct up here into the subclavian vein, down through the heart into the liver, and that pulls the toxins out. And if the lymphatic ducts are full of sticky icky stuff, so literally there's fat, there's all kinds of substances that conglomerate, right? So they make like balls, and it's if you think like a hose, but you have the nozzle at the end of the hose closed, stuff can't flow. So there's studies that show that in rats, if they inject them with cancer cells and they do nothing, they have X amount of metastasis. And if they do stretching of the fascia, just by affecting the fascia, they get significantly less metastasis, right? Because it's allowing the whole immune system to work.
So in it, and you have in your course, you have a little section on just going through the lymphatic system and the lymph nodes. But one of it, going back into the initial thing, you had Sid, who is the great model dog, and you talked about just general using for inflammation, and you talked about starting up by the head and going in behind the ear and along by the neck, and sort of roughly following many of the acupuncture points along the back.
Yep.
Is that an easy thing to show, or do you think?
Yeah, absolutely. And what's really cool is I study like geriatrics and brain function and stuff like that. So if you think about it, the carotid artery comes up here, right? And then it bifurcates, and you have two, so your cranial and caudal artery that go into the brain. The jugular vein actually, if we look at the back of his head, comes through the jugular foramen. So blood comes up through here, but blood and lymph, the lymphatics from the head, come out through the jugular foramen here. So acupuncture-wise, we talk about gallbladder 20. That's right over the jugular foramen. And if you've ever had a headache and you rub the back of your neck and you're like, oh my God, that feels so good, now my headaches goes away. Guess what? You're rubbing the muscles, rectus, capitis, lateralis, and major and minor, dorsalis, major and minor. And if you come up here, can you show? Thank you. You do that. If there's fascia that's sticky icky around the lymphatics or the jugular vein, coming in here and just doing this relaxes all of that. Can I do the other side?
So that's just in behind at the base of the ear. Is that right?
Yeah. So here, if we come, here's his occipital ridge, right? The bump on top of his head. If we slide our fingers down, our fingers fall into a hole. Right where that hole is where the jugular foramen is.
And that's that you said gallbladder 20.
Yeah, gallbladder 20. Yep.
Yeah, it's right there. Wow. Okay, so that's an easy one for most of us.
Yeah.
Oh, my cat. I wonder, so would he have the same thing?
Yes.
So right in here, on either side.
Yeah. Feel how you have that nice little hole?
Yeah, and it's an obvious depression, so most people would feel it. So you would use that. Was that just where you would start? Like if you're just saying for general.
Yeah. You can do that. If you know nothing else, you can even come down the bladder meridians on the back of the dog or cat.
Yeah, you talk about starting there. You talk about going along in between the shoulder blades, and then we're paralleling the spine on the other side.
And what's really cool, now he doesn't have a lot of, he has a sticky icky right there. When we talk about sticky icky, remember we talked about, here, let me put you down for a second, buddy. Thank you. I'll give you a cookie. So Andrew, I want you to take the back of your hand and slide the tuning fork on it. Unless you're dehydrated, it should slide really easy. Yes?
Yeah. Yeah, it is, yes.
So then I want you to come to your neck and see if it slides easy or if it's like sitting in peanut butter. It's kind of hard. Yeah. You feel like grab?
Oh, yeah.
That's sticky icky.
Yeah.
So that tells us there's a fascial restriction there that may even affect how much you can turn your head. And just putting it there and letting it do its thing will get rid of that fascial restriction. So each time you do it, you slide down and then you're like, oh, wait, there's a fascial restriction. And then you do it again. And then you'll be able to go a little bit further until you clear the whole muscle. And it should, when it's clear, feel like you were just sliding on your hand. And depending upon how much junk, sticky, icky stuff there is in the muscle is going to depend upon how long it takes for that to clear.
So do you hold it? It's about a 45-degree angle. Is that right? As you're going along.
I put it, great question, at a 45-degree angle to find the sticky icky, and then I turn it perpendicular because then you have more surface area.
Okay. There is as a sidebar, it's called a Skinar, which is something like some Russian type TENS machine. It's a little bit different, but it's essentially to deliver, it's got a little battery and it's delivering these little electrical impulses, and there's different, and it's being produced in different levels, like I think equivalent of different hertzes, right? Different strengths, but you'd run it along a muscle or something that's sore, and that's exactly the same thing. All of a sudden it's sliding on your skin and then it stops. And I'm like, is that? And that we had a chiropractor we had a son who injured his knees, jumping something in skis and blah, blah, blah. He's like, nothing else is working. He said, you should try this thing. And that's what he used. I'm like, is that? But it's a thing. I mean, and it consistently, and I've noticed that. So when you say that, I'm like, okay, that's exactly the same thing, right? Where all of a sudden there's energy flowing and it's moving but as you're saying, you've got fascia under there that is restricted for whatever reason. Okay.
Yeah. Yeah. So, and it's the same with the dog. Even if they have a thick coat, you can, Sid, come. Like you saw in the videos, I can come, let's see, gonna get you a little bit higher, buddy. There you go. I can come down his back, and if he's got any issues, it'll can you see that grab? Right?
Yeah.
It slides and then it grabs. So it would be beneficial for him for me to come here and do that, and that'll clear that. And then once it clears it, it'll be able to go past that.
And is it something like just once a week? You could just start at the top of your dog's head, go along his spine and heel base, or what do you?
Could do it once a week, and literally, what's going to happen is you're going to do it, and the first time you do it, it may take a long time because it's years of stuff building up. Like with my patients, when I see them, the first time it may take 20 minutes to go through, and then after that, it's a minute or two. You find one or two little things because you clear it. And unless they have another issue, it stays cleared.
Okay.
Right? Same thing with the lymphatics. You clear the lymphatics. I clear my lymphatics and then I fly somewhere, they're going to be sticky icky again. But the first time it took me 20 minutes to clear my lymphatics, and now it takes 3. Right? Because you got rid of most of that sticky icky stuff. There's studies that show that by clearing the fascia and the lymphatics, you increase the immune system's ability to fight disease, and you decrease the immune system's chance of going into autoimmune.
Oh, really? By just having your lymphatics working properly. So it's draining all the stuff this way and in your thoracic duct and dumping it into some vein and whatever the vein is, and pumps it up to your liver eventually. Okay. So and it's the same in the animals. Okay.
Yeah.
So, but then would you do it like, say for Sid, obviously he gets practiced on, but do you just sort of do it as he needs it? Is that sort of how you do it? Or?
Yeah. Well, the fact that I just found that spot on him when we get off the phone, Mama's baby.
Okay.
Right. But yeah, I mean, I see my clients, for the most part, sometimes once a week. Most of the times I get it so I can see them every 4, 6, 8 weeks, right?
Okay.
And then I see them and it'll be like 1 or 2 spots that I need to clear. Or a lot of my clients have the tuning fork and then they do it before they come
Oh,
in, which
that's
makes it
perfect.
much easier. And then I just find the little things.
Okay, nice. You also, and then so you started with there, and then you had one which really good. Just give me a little anatomy review because you talked about then some specific muscles and muscle bellies that were really important to look at. Some of the ones I'm like, oh, I remember many of those muscles. Of course, not all. But there's a few that you mentioned that you said, like, if you're going to look, if your dog's sore in the front leg, go here. Your dog's sore in the back leg, go here. Those are good to know. I mean, for me, they're good
Yeah.
to learn.
Oh, yeah. And, things like how far should your dog's front leg be able to go? And how far should it go back? Right? And if not, where do you put the tuning fork so that you can do that, so the muscles can stretch? That's all in the course, right? Front leg, back leg, gracilis, and all
Right.
of these guys.
Right. So there was one, I can't turn it from my cat. It was good. You showed where the triceps was because you were saying if there's ever a problem in the front leg, so you said most commonly it's the triceps.
Yep.
So
So come up. So you've got the top of the scapula or shoulder blade. You have the point of the shoulder, and you have the elbow. And the triceps, triangle, is this whole muscle here. So tri is 3, right? But he actually has 4 muscle bellies. So it's in this whole area, and you can feel the problems, and literally just take the tuning fork and put it on that area. So, for instance, can we play?
oh
Feel,
yes, that's true.
Feel a trigger point in your traps.
Okay, yeah, there's trigger points. Oh yes, okay. Yeah,
And then
right there.
activate
Yep.
the tuning fork and put it on. And usually within about 20 or 30 seconds, trigger point's gone.
I should be using this.
It's cool. I use it on my neck all the time because from looking at the computer, working on the computer, or head down working on dogs.
It's nice too
Right.
because
Feel it.
the Scenar thing that we have sends a little electrical impulses, but they're not necessarily that friendly.
Oh yeah, this is super comfortable.
This is nice. Like you're feeling this nice vibration, but I think it's a nice way versus trying to zap your dog or your cat with something too. This is a much nicer way as far as treatment goes. So you talk about, because you were saying the triceps are more common, and then the back, like I said, you talk about one called the gracilis,
Yes.
which, okay, I didn't even think about the gracilis. There's a couple of little muscle bellies that you mentioned, because I remember when I first started in practice, there's a little muscle, that one called the pectineus, which is, right
huge
deep in the
for
groin.
hip issues.
So I remember they used to do surgery. I remember
they used to cut it. It's one of the major hip stabilizers.
Yeah, he used to cut it he said, for hip dysplasia. This is one of the vets I worked for when I first started.
So understand, it did what it did for a short time, right? So if the hip is in socket, but it's bouncing around and it's creating inflammation, and now you've got bone rubbing on bone instead of cartilage, nice on cartilage, and you cut the pectineus, all of a sudden it drops, and now that hip is actually rubbing on a different area. So they would see, for the hunting dogs, they would cut it, and the dog would have 6 more months, and then they would euthanize the dog. So what I found was, instead, if you take that dog that's bouncing around and you release the tension in the pectineus and the glutes, which are your hip stabilizers, and then you strengthen them, the dog doesn't have pain anymore. And they don't just have 6 months to live after a surgery. They have a much better quality of life for years.
Oh, so these are these dogs you could actually.
Huge. Yeah, absolutely. I can't tell you how many dogs I've worked with that the owner comes back and says, oh my God, he didn't need that second surgery, or, oh my God, he jumped on the bed for the first time in his life, or things like that. I mean, it's just heartwarming. I love that. I'm never bored. I love what I do.
Wow. Okay. So that's all. Honestly, we didn't get taught. Well, I'm sure I would suspect where you were in vet school, Colorado State. Dr. Laurie and I both graduated the same year, 1992. So we probably would have had similar types of education.
Right.
And there was nothing around anything alternative,
Right.
as I suspect. Maybe Colorado State was different where you were. I don't know.
No.
And yes, and I didn't hear anything about any type of therapy, any rehabilitation. There's no talk of any of that. But
Right.
things
So
changed.
even things like, I am so excited. Sid, come up again. Thank you. When I went to school, and Andrew, I'm sure it's the same for you, that you can tell me, we were taught that if you put pressure down the dog's spine and they screamed, cried, or dropped, or tried to bite you, that it hurt. And to me, that was never cool.
Yes.
Right?
Yes. Okay.
Right?
Yeah.
I'm like, that would be like me hurting you enough that you swing at me, right?
That's a good point. You probably shouldn't
Right?
do that.
Right.
Yeah.
So I discovered a way that if you have, I don't know if you can see my hands ready up here, my hands underneath him. If I put gentle pressure down, the first thing that's going to happen if he's uncomfortable is he would contract his chest or abdominal muscles. So it's a much nicer touch. Yeah.
Oh, I would put hormones up. Yes. Yes.
Right. And now there's some of the vet schools that are teaching that now, rather than push really hard and see if they scream.
Okay, so maybe hopefully you're teaching some of those vet schools to then maybe teach that. Yes.
Yeah, that's why I teach, right? Because to me, I'm empowering people to help the dogs, and that's where my heart is.
Yeah, I'm gonna grab my cat just to see if there's that one other back leg muscle I'm trying.
Yeah, gracilis, sartorius, tensor fascia lata, gluteal.
Yeah, because you said so. Imagine you, my upside down cat. He's not very much. He's actually pretty tall, right? He's from an animal shelter. He was found in a canyon, and he's very tall. Awesome. You're saying there's a little, you call it a gracilis, like the shape of an egg. That's right on the very back of your, especially if you're putting your dog or cat upside down, and the very back of his leg here. Correct? Is that about where the gracilis is?
Your cat's already has his hip inflection. So if you up around the hock and bring his rear toes toward his elbow by extending his knee.
Extend his knee.
Yep. The muscle on the inside of the thigh that gets really tight, that's the gracilis. Yeah. And it has
I can feel it.
Wide tendon on top and a big wide tendon on bottom. And that's why I love a hard-boiled egg.
Okay, and that's gracilis. And you're saying that's a real common one.
Very common.
To have trigger points.
Yep.
So you're saying, so really you're feeling, you can just palpable feel it.
Yeah.
And or do you feel it? Do you go and palpate first and feel the trigger points, or do you just use
I find the problems, so I put them through the stretches, and then if there's a problem, I fix it. So when I'm working with a dog, it's constantly find it, fix it, find it, fix it, find it, fix it, find it, fixed it.
Okay, so you're going through all those like different diagnostics first, using that. And if there's a trigger point, then you're taking out your tuning fork, or maybe you're using laser, depending on what you need. Okay. Yep. But that would be something, because just how we can feel a trigger point in us, right? Yeah. Similar, you can feel those. I know one of the last of my many last dogs, I had a black lab cross who was just a big dog who was forever jumping and doing stuff he shouldn't necessarily do, but he would often have a stiff back, and you could just run your finger on either side of his spine and often feel these little knots in the muscle.
Yeah.
This would have been great for that.
Absolutely. Yep, would get rid of it. Absolutely.
Okay.
Can
you'll palpate
there?
Is what? Sorry,
I said, can I share one more thing?
Oh yes.
Super important is you have the amethyst tip. The other one I use I use every day, not on every client, but yep. So the lapis, right? So lapis is, let's see where you go. There you go.
Yeah.
It's blue, right? And it's got pyrite
purple
things in there. Is amazing for scar tissue. So it melts. Like you could not believe how fast it melts. So like I had at one of the conferences, I had a nurse from Stanford who was a concert pianist, and she couldn't play because she had scar tissue on her hand. And literally she did it herself. In about 2 minutes, it melted and she had full motion in her hand again.
Really?
Yeah, seriously. blows my mind. My brother-in-law had a disease, I think it's called like Dudamitrins, where there's gets scar tissue in the tendons in the hands and the fingers curl in. 6 months of PT, couldn't fix him. They were going to either go in and scrape it, and of course, if you go surgically, it's going to scar again, or inject collagenase, right, which is going to break up the scar. And I'm like, Bill, but you understand your tendon is made of collagen too. And I was there for 4 days, and in 4 days of him playing it, every time he sat down, he had full extension of his hand. I was just at the Minnesota meeting.
And that's using, but you need to change.
You need
it's
to change,
better to use.
right.
Change
I
the
was
crystal.
just at the Minnesota meeting, and a veterinarian named Mary had scar tissue from an incision on her belly that was literally indented. And in maybe 5 minutes, we worked on the top half because it was under her belly button. It was almost flat in 5 minutes. It just breaks up the scar tissue. And the reason I know this is because Sid, my heart dog, had emergency abdominal surgery, and I was traveling, and I came home, and we thought he had a foreign body. Thank God he didn't, but it was infected, and he had significant scar tissue. And my dog that can do sit up and bag and do bag stand bag like 60 times in a row couldn't even do sit up and bag because of the scar tissue was broken down. And I lasered it. It helped a little bit. I used the amethyst. It helped a little bit. I'm like, what do I do? What do I do? What do I like? Wait, lapis. Lapis is good for scar tissue. In 8 minutes, it was totally flat, and he had full range again. Really? It's crazy. It is unbelievably crazy. I would love to work with a human doctor who we could do some research with.
Wow. So you could talk about in your court, you talk about even just people having spay and neuter incision.
Yes.
Animals, and that can restrict movement. You say, like, just that alone, I never thought of it. But if I've got this incision in my abdomen, there's a lot of things I can't do.
Oh, can I tell you another story?
Definitely.
I was at the AVCA, so the American Veterinary Chiropractic Association, and one of the chiropractors came, and we ended up, she had no physical scar here, but I'm like, okay, the lapis wants to come here, and we literally treated, she was all sticky icky, and then it cleared, right? And so it was slid, and she's like, oh my God. I'm like, what? She said, she's 40. When I was 17, I had my salivary gland removed, and I haven't been able to move my tongue fully since. And now I can move my tongue fully. Crazy cool, cool stuff. So it doesn't even have to be scar tissue on the outside. So when you talk about space scars, I mean, I know I work with a lot of highly competitive athletes, right? And there's so many that they get spayed, and then they're not as fast. And it may not be the scar on the outside, but scar tissue on the inside, and it gets rid of that.
Wow. Okay. And how about it even just post-surgery? So you had your dog's had knee surgery, and
but now you have to wait till the incision heals, right? So you're not going to put it directly on the incision for 12 weeks. You want it to heal rock solid, and you should be doing massage and range of motion and all of that stuff. But if you don't have full range of motion, or you think there's any scar tissue in there that you want to get rid of, absolutely. And you'll know because it's sticky icky. And what's amazing.
And you wait for how long? You said you want 3 months?
I do. Right. Maybe it could be less, but that at least with 3 months, it's safe.
Okay.
All of the healing should be done by then, right? Think about when we did surgery originally, we'd say, okay, in 10 days, we can take the stitches out because it's 10% healed.
Yeah.
Right.
Yeah.
So we want to wait till it's healed.
Would be awesome for like post-op stuff, and I never thought of that. And it's something that would be easy to do. And you even show on the knee that it's not, you don't need to have the exact point. It's that you're just feeling where the restrictions are, and you're running right.
And what's sticky icky, right? If it slides, you don't need it. If it's sticky icky, you need it. And when it's not sticky icky anymore, it's better.
Okay. What about, this is not a dog related. What about someone who has carpal tunnel, which is?
So could it help? Absolutely. And when you look at the research, there was a study done that looked at humans that were scheduled to have carpal tunnel surgery here. And they lasered their lower cervicals, And at the end of the study time, like 80% of them did not need surgery. So there's thought that yes, some of it is going on here, but some of it can also be coming from the lower cervicals. So if you had carpal tunnel issues, can you treat this? It would probably make it feel better. And I would use the lapis, right, in case you have scar tissue. I would try both, right? Um, super, super cool. There's times where it's sticky icky with this one and not this one, or vice versa, right?
Wow.
So you say, okay, is there anything sticky icky back here? Clear that. Does it still hurt? Okay, if it still hurts, is it sticky icky back here? Clear that. Okay, does it still hurt? Then treat locally, right? Because you can treat locally, but if the root cause is up here, it's going to come back. If you treat the root cause, you may not even need to treat here.
Back there, base of the cervical spine. Wow.
Yeah.
Makes sense. Okay, where there's. Okay, one of the other ones that you did, one of your little modules was on all the little acupuncture points.
Yes.
And it's a lot, because I remember writing it all down. Like, you covered 10 acupuncture points at least. Plus, there's one that go along the spine, all the bladder ones, which is really good because you actually show them where they are and you're using the little tuning fork on them. But there was a couple that you mentioned that I think you talked about obviously some stuff ringing with anxiety, and I think you talked about one on top of the head.
Mm-hmm.
There's one called is it called the yin tang? How did you pronounce it?
Yin tang.
Third eye.
Oh, can I tell you some really cool stuff about that?
Yeah, so, yes.
You know, I'm a research nerd, right? I own that 100%. So I'm like, why does it have such a big effect, right? And if you take take this one, right? We've said up here it has an effect. Here it has an effect. Well, and you can't see that. So third eye is right there, right?
Right up here. Okay.
And so if you put it here, but then you move it an inch over, it doesn't feel the same. This has a much bigger effect. Mm-hmm. One, we have sutures here. But two, I found out that the fascia around the left and right hemisphere of the brain actually attached to the skull here and here.
Well, that's
so
brilliant.
You have like direct connection to vibrate the membranes around the cerebrum. Yeah.
Like you're hitting that fascia. Oh, that's interesting.
It's so cool. Right? And it makes so much sense.
Okay. And also you showed one where you were treating, I think you're treating Sid, and you said you could feel it through him already. Yeah. You're feeling it on the other side. Like, so your point is like these sound waves, they travel a long way through the body. It's not just that you're just affecting something under the skin, like completely through him, I think his foot or something, but all the way through the paw on the other side, through bone and soft tissue on both sides. And then, so yeah, that's something you never think that would happen.
Well, and think about this. If somebody is full of what I call sticky icky, you may not feel that. And then when you clear it, you can feel it. Right? Because it's what's absorbing. So it's the same way if you do this and put it on top of your head. If you're not stressed, it'll vibrate for like 30, 40 seconds. If you're stressed, you get fascial restrictions between your scalp and your skull. And it'll be like vibrate, dampen. Right? Because it's absorbing that energy. And it's the same thing with the body. And I can't tell you how many times I will like put it on someone's trigger point here and they'll be like, oh, I feel that down to my fingers, or I feel that down to my toes. So it could be that we have a nice track that's going all the way through, and it can be going through the fascial lines, which connect and go through the body.
There was one of the acupressure points I think you mentioned, you said it's just for any older dog, or I assume older cat. I'm going to find my critter. Oh, here he is. Was it not, I think, is it GB23? It's something you said to go to the end of the ribs.
Oh, bladder 23.
Oh, but was that it? You go straight up from the end of the ribs.
Yep.
Right here. And that's called BL, or bladder 23.
Bladder 23 is great for the kidneys. It's great for older animals. It helps build internal energy. And here, sit up. Thank you. Right. So if I come and look at him, and so his ribs come here, and then it comes up, comes this way. But if I take the end of the ribs and come straight up, there's a hole, there's a depression, and that's bladder 23. Right? So his ribs are sitting here.
Yep.
And it's there.
And if you're not, okay, so saying I'm treating my own animal and I'm not right in the exact point, because obviously you do acupuncture as well. Is that correct? Like you know your acupuncture points, you know your meridian, you know all your stuff, you know where to go and you know what to feel. But being a non-acupuncture trained person, not being 100% sure, but if you're close, it
may have an effect, and it can never hurt anything. Okay.
Right. Okay.
You want a really good laugh? Yeah. I've done like persistent right aortic arch surgery on a dog, right? So I've done heart surgery. I've done all of these things. Wow. I'm needle phobic. So like if I have to have blood drawn or go to the acupuncturist, I can't look. So my acupuncturist will literally put needles in me, and then she'll take a Sharpie and put dots on me so that I can come home and use a tuning fork and stimulate it. Because if I'm dying, I will put a needle in myself. But other than that, I like get sweaty and all of that stuff, right? So we all have our gifts and challenges, and that's one of my challenges. But I can tell you the tuning fork on the points work really well. So as good as a needle? No. Much better than nothing? Absolutely.
Right. Okay. So you would use that. Is there any other easy to hit acupuncture points as far that you tuning fork that might be simpler?
So
I was trying to think because I wrote, honestly, your course is really worth it because I think I wrote about 10 different ones down. Like, oh, do this and this and this, and I had to like go back because you cover a lot in a short period of time, which is great. So for anyone who's wanting to take it, it's very worth it because they're going to get a whole lot out of it, and you can refer back to it too, right? Because once you're
you have it for a year, and you can always keep it after that. And if you purchase the course, as long as you're in the United States, the tuning fork comes with it as a bonus. So that I never wanted anybody to say, Laurie taught me this, and they bought something cheap off of eBay or Etsy and it not work. So I source these from a very high quality place. The stones are literally hand carved in Tibet. I order it and it takes like 3 months to get.
You said Tibet?
Tibet, yes.
Hand carved. Wow.
Hand carved in Tibet. Yep. And this way is, again, I sent one to somebody in Canada when we first started, and it was $50 in shipping. I'm like, okay, we can't do that.
Yeah.
But yeah. But yeah, it can with the amethyst tip because that's what you're going to use the most. So, all right. So point. So for humans, we talk about the headache point here. Well, it's not really here. It's literally, here is the metacarpal bone, halfway in, straight in there, right? So if you have a headache or inflammation, pain in the face, or the front leg, that's a great point. Sid, come to me.
Sid's a good dog.
Thank you. So if I look at him and we pull him up, here's his dew claw.
Yeah.
Right. That point is right inside the dew claw. So really easy to find.
And for a dog, what would you be using that? Because he wouldn't tell you he has a headache.
Well, some dogs get a hot head, and and their ears may get hot. So they do get headaches. At least I think they're headaches.
You're probably right. They do. Just because they don't communicate, they can't say I have a headache.
Right.
True enough. Right. So everything else they get, yes.
Yep. So yes. So any kind of inflammation in the front leg, that might be helpful for. Another point would be for the front leg.
And that's an easy one. That's an easy one to get to.
Right. Easy one to find.
Inside the flap of the dew claw. Okay.
If you have the point of the shoulder and you come straight back, there's a hole right there. That's SI9. That's a great one if they have like elbow or shoulder issues. That one is really good. If you look at, here's the top of his scapula. Here's the point of his shoulder. Halfway in between, right in front of the scapula, gallbladder 21.
That's what you just
said. Another amazing point for neck and front leg issues. If we go to the back end, can I have your butt, buddy?
He's so good.
He's so good. All right, so I've got his butt. if I come, here is his tuberculosis, so the back of his pelvis.
Yep.
I have an indent and then his femur. So his femur sitting here. On
Yep.
top of the femur, in the depression behind it, and halfway between this and the wing of the ilium, there's an acupuncture point. Those 3 points are called the hip triangle. And even if you're like, oh, I can't remember all that, hold on, baby. Let me just find a tuning
Just
fork.
okay, grab his thing, probably move it, right?
I was going to say, you can just come in here and say, wait, stay here. I got you. I won't let you fall. Coming in here around the top of the greater trochanter, around the top of the femur, where is it sticky icky? Anything that's sticky icky tells you there's an issue, and you just stop and let it do its thing, reactivate, and just clear that, and that will help.
Right. Okay. See that as opposed to because you're so I've even done I think through VA, and I think even did I did a little acupressure course, but you're never 100 like I think this is it, and I look back at it, you don't know for sure, and you're like, is this gonna? But as you said, you're not putting an acupuncture needle where you would have to be much more precise. You're in the area. And so often, though, you've said they are in these depressions of the muscle. You've got muscle belly joining something, and there's maybe a little piece of fascia.
Hi, hey guys.
Hi, Liza.
Trying to get to here. Here we go. Sorry to interrupt. I just wanted to say we are at the point where we usually do a Q&A. Would you guys?
We are okay. Have we got everything covered? Okay, so she showed us acupressure points. She showed it. The only other we talked about scar tissue, and we talked about trigger points. We talked about lymphatic. Okay, only quick other 2 things. You talked about just the importance of the lymph system and draining the lymphatics properly, and how using the tuning fork really helps. And even show, like in your course, you just show like where a few key lymph nodes were, like where's the cat priest. So then where's my critter? Right. But you talked about, especially you talked about, right? Okay. Interesting. You said 75% of the lymph system and lymphatics is draining on the left.
Yeah.
25%, which I had no idea.
So before you're born, everything's 50-50. And the minute you're born, a whole bunch of lymph ducts shut down. And then after that, only it's the right side of your head, your right arm, and the right chest drain on your terminal duct. And 75% of everything else on your body drains in the thoracic duct. So in vet school, we didn't even learn about the terminal duct.
Yeah, but why is that?
Right. The way we're made.
Okay.
But clearing.
And Ozzy, you know what the lymph does, like the whole lymphatic system?
Sure.
Okay. We have these lymph nodes. You know what a lymph node is? It gets big when you have the sore throat, right? Infection.
Do you want me to give the answer?
Inflammation. Hopefully not. Hopefully not cancer. But the point, but Dr. Laurie was showing how to use it on your lymphatic system. Because if you can have your lymphatic system draining properly, like it's whatever's going on in your body, it's fought all of this infection because it's produced these lymph cells, and they've dealt with this infection, and it's draining all this stuff. I mean, it parallels the blood system often, the whole lymphatic system. But you can use the tuning fork to actually help move. Often it's plugged up, say, in the lymph node. You get it to drain out through that lymph node into a big duct. But you showed one spot, Laurie, on there, I think on the front, up here. Yeah, and you had it showing here. So say you felt the lymph node and it's large. Here's your big lymph node.
Put it right over their lymph node. Yep.
And you said like you're going to move it over the lymph node, and you're going to move it towards the thoracic duct. You're trying to get it to, and then
right. You start with the thoracic and terminal ducts, and then you go to the lymph nodes, and then you go all the way down.
Okay, you start with the ducts, go to the lymph node, and then the idea is it's going to
clear each of the lymph nodes, and it goes from sticky icky to not sticky icky. And then, so like the whole reason I got into the tuning forks is because I broke my fibula, and I'm a rehab vet. So I had huge swelling, and I was doing laser and acupuncture and chiropractic and ozone and physical therapy and CO2 therapy. And it was still huge. And I'm like freaking out. And my physical therapist is like, Laurie, stop. It will take a year to a year and a half to go away. And I went to, yeah, isn't that crazy? I went to Patrice Corticus's class. She does an osteopathy class in Oregon a couple times a year. And she says, I will fix you. And she did exactly what I'm talking about with the tuning fork. She doesn't use the tips. And she, in 72 hours, 80% of that swelling was gone. And in 2 weeks, the rest of the swelling was gone. And I'm like, this is amazing. You only come to the United States and teach like 12 to 20 vets at a time. A couple times a year, we need to figure out everything that this stuff can do and help people, because it can't just be that few amount of people that learn about this.
So what happens, you had this fracture that's healing, but it plugged up. So nothing is, you've got all this local icky. Right? It's just not moving. So you've got all this scar tissue, this fascia that's all bound down and not allowing anything to flow. So can you remove, because you've got inflammatory cells go there to heal, which is great, but then now they're sticking around because they can't leave.
Yep.
So can you get that lymph system to move again? Wow. And that worked.
And it worked. Wow. 72 hours, 80% of the swelling was gone. And in 2 weeks, even with a flight, the rest of the swelling.
72 hours. And they said it would take a year.
A year to a year and a half for it to go away from the physical therapist.
See, that's that's not a, okay. So big benefit. And the other thing there's that, which I was just, I'd have to spend more time trying it out on a patient dog to get the hang of it. And you even talked about using it for the diaphragm. It was interesting.
Yeah, you can clear the diaphragm. And actually, I just like what Eliza came on, I watched a question that came up that said, can you use it on IBD for a cat? Can I answer that question? Because it's
go for it.
So in your solar plexus area, there's something called the cisterna chyli, which is the lymphatic tissue that drains all your abdominal organs. And with the citrine, so it's a yellow tip, right? It's so cool because I go to these conferences and I try to teach vets and the people that are there what they can use this stuff for. And I had somebody come to me and say, I'm like, how can I help you? And she said, I've had ulcerative colitis for 12 weeks. And I'm like, I'm a rehab vet. Okay.
Wow.
I'm like, okay, how can I help her? How can I help her? I'm like, citrine or honey agate. They're both amazing stones for the gut. I'm like, let's see this. And sure enough, her solar plexus area right below her, where her diaphragm is, was totally sticky icky and like really bad. Like it took 20 minutes to clear. And the next day she comes and says, Laurie, I have to tell you, last night I did the skinny dance. And I'm like, okay. She's like, no. I had pizza for dinner. And I'm like, okay. She's like, I have not had a meal in the last 12 weeks where when I got done, I didn't look like I was 9 months pregnant. I had no information at all. Wow. And then, so when I saw the question that came up about IBD, I don't know. I can't guarantee it'll work, but it certainly worked for that person. And I know if I get bloated or I have stomach issues, I take the citrine or the honey agate and clear it, and it feels way, way, way better.
Well, I guess if the sound waves are penetrating through all that soft tissue, but I guess Sid is trying to tell you something.
Yeah, he's saying my dinner's over there.
Okay, because it's late for you, right? Because you are 3 hours ahead. Liza, so the solar plexus is right where the ribs end, right? I guess where they right, this little point. You can feel it on your belly. You know, have you ever, when you got yourself winded?
Oh yeah.
In soccer, Eliza, yes, right there. You got hit in the solar plexus.
Yeah. It's not a great feeling.
Right there. And so beside the ribs, as the last rib runs down to the spine, the diaphragm attaches on either side of that. But then what would be a reason when you might do that? Like, how would you suspect that would be an issue with your dog?
Well, if they have inflammatory bowel disease, if they have vomiting, diarrhea, anything like that, I would try it. And if it's sticky icky, keep doing it until it's not sticky icky. And there's a good chance. I can't guarantee it because I haven't tried it on everything, but there's a good chance it'll help. But again,
because you're saying you want on either side underneath the rib with that tuning fork, And then you're saying because the diaphragm itself, every time it contracts, it's helping move lymph through the body, like lymph fluid through the body.
Two different things. So if I was just trying to clear the diaphragm, I would probably use the amethyst. But in the same area as the diaphragm, if I'm trying to clear the cisterna chyli or the stomach or the intestines, I would use the citrine or the honey agate, the Yellowstone.
Okay. And do you think it's working because it's working on the fascia primarily? Is that?
Yes, absolutely.
Wow.
Yeah. And decreasing inflammation, letting things drain, right?
Right. Because stuff is scarred there for whatever reason. Things aren't moving, and that's the problem.
Yep.
Getting to the root, the underlying cause instead of just some drug to mask it. Okay. Yep.
Okay. I'm going to cut you two off now just because also I know you have lots more that you could talk about and people do want to hear it. So I'm thinking we could do a part 2. So that could be something we talk about later. But for now,
laser, we could talk. There's more stuff. We have laser therapy.
Exactly. So let me just ask you guys some questions now. There's certainly plenty of questions for people in the chat. So thank you to everyone who's been asking these questions. We'll do our best now to answer some of them. I can't guarantee we're going to do them all, but there will probably maybe be a part 2 to this. So keep your eye out for that. First thing, and one of the most frequent questions we're getting, Dr. Laurie, is just about tuning forks. So where can you buy them? And then what's the difference with like the stone on the back? So I know someone actually mentioned that they found something on your website that actually was talking about the differences in that. So for people watching, Dr. Laura's website is Optimum Pet Vitality. We have it linked in the description, so you can go check that out. But for now, if you were a beginner wanting to get a tuning fork, what's the best thing to do?
Honestly, it would be to buy the course because then you get a high quality tuning fork for free.
There we go. Okay.
And I would agree. There's no point just getting the fork. You need to learn how to use it properly and go through it. And I just went through it one time and there's lots of information. So you want to refer back to it for other things as you're learning how to use it.
Okay. Well, we have that. That's linked down below. It's linked on Dr. Laura's website. But if you also want to get a bit of a discount, use code Dr. Jones 10, or it's in the bio. I might have actually quoted that wrong, but definitely go check out that course because it sounds very great. And like it'll be a very good description on how, where, and what tuning fork to use and all those. Because there's been lots of questions about that.
Sorry, Eliza, what time is it where you are right now?
I'm in the Netherlands right now, and it is after 2 a.m.
Okay, well, you're very alert for 2 a.m.
I had an Earl Grey tea, so. Anyways, a few more questions. Okay, some other questions people were asking though was about the frequencies of tuning forks. Just does it matter? And do all tuning forks have the same frequency?
Great. So does it matter? Yes. The ones we have are 128 hertz because that's the frequency of fascia. I have bought and played with it. Yep. I have bought and played with a 256 because that's supposed to be really good for bone. But what I found is you can only get them without the weights on them. When you have weights, it pushes the energy down to down here so that you can put pressure on here and have it go into the body. Otherwise, the energy is all up here. So even though that frequency is maybe good for bone, you can't get it into the tissue. So yes, frequency is extremely important. And 128 is because fascia wraps around every blood vessel, every nerve, every lymphatic vessel, every muscle fiber, everything. That's like your go-to.
Okay, good to know. Next thing then is, you guys did touch on this a bit, but some people joined a bit later. Does it help remove inflammation? As in, does it help arthritis?
So yes. So does it help remove inflammation? Yes. Arthritis is inflammation of the joint. You can use it to drain inflammation through the lymphatics. You can use it to get rid of the scar tissue around the joint. So it can definitely help. It can increase range of motion in the joint. And if you think about it, if all you can do is this, everything around it that supports it weakens. If you can get your full range of motion and then you can strengthen all the muscles, tendons, and ligaments, that helps stabilize the joint and makes it more comfortable.
Okay.
And I was using it on. I have a bit of a knee thing. I'm running and doing stuff. Probably far too long, but regardless, training for something, which means I'm doing lots of running and beating up my knee. So I've been using something else on it. So I tried this, and I can concur. It definitely felt much better. Pretty much immediate after. So I'm like, okay, I'm gonna stick with it. So I'm gonna be my own guinea pig. I'm my own guinea pig. Let's see.
It certainly sounds intriguing. I think I want to try it now as well. Okay, next question that we have is the fascia also closely related to the lymphatic system?
Yes, the fascia wraps around every lymph vessel and around every lymph node. So if the fascia gets sticky, icky, it literally compresses the lymph ducts, the lymph nodes. So, and that in itself also decreases the ability for the lymph to flow and then dump out and get rid of all the toxins and everything.
Okay. Next question was, if someone is using a tuning fork on their dog and they hit a sticky, icky spot, are you going to get a reaction from the dog, or is it more this that you'll feel it in the fork?
If anything, the dog will relax. So it'll feel like you're coming and sitting in peanut butter. It's just that squeeze, and then you turn it up. I say you turn it up. Like when you're going through the diaphragm, you're actually going up under the ribs to clear the diaphragm. So you can aim with it. But if anything, I have worked with dogs who are like, the first time you activate it, they're like, right? Because they come in the first time you're working with them, and then they stop panting, and then they sit down, and then they lay down, and then they go, huh. We call it melting. They literally just boom into the ground.
Wow.
Yeah.
Wow.
Cool. So that's the kind of reaction I see. Oh, the one thing to note is don't do it over a tumor, because if we don't want to increase blood flow to the area. I have multiple clients that use it with dogs with seizures, but in humans, there is several cases of, like, millions of people have seizures, but there have been a couple cases that a frequency has triggered a tumor, triggered a seizure. So you just want to be careful with that.
Okay.
And dogs who have had excessive, dogs who have had a lot of shock with a shock collar, right? Sometimes those guys, again, I've had lots of patients who don't have issues, but if your dog has had a shock collar on, you want, and if it buzzes or vibrates before they get the shock, you have to go really, really slow so that they don't freak out.
Yeah. You feel the vibration, like, is that
right?
Yeah, precondition.
Okay. Oh, were you going to mention something?
No, one of the ones someone asked about degenerative myelopathy. I think DM is what they're at.
That was my next question. So perfect.
Okay.
No, you go ahead.
I don't know if it would help or not.
I don't know. So when we think about what DM is, degenerative myelopathy is a misfolding of the myelin sheath around the nerves. And so the nerve transmission decreases and then stops, which is why we go from an ataxia or stumbling in the back legs to total flaccid paralysis of the back end. Then we lose continence. Then we lose the front end. And then they have trouble breathing. So would the vibrations help? I don't think it would help the disease. If the dog has like stumble, twist, or they also have elbow arthritis or something like that, I think it would help the other things. But in my brain, I don't know that it would help DM.
One of our last dogs, Eliza Jesse, that's I think what he had in the end. Like he was folding. He wasn't painful, but he was knuckling where his back leg, he was folding his paws on his back leg. He had obvious, and it was progressing. They probably had degenerative myelopathy as well. But yeah, that's because a pretty hard disease to treat, period, right? Because
Right.
Yep. The whole idea there is, I've treated hundreds of them, is to get them as strong as possible, right? And you can use like Neurotrophin from Standard Process. You want to do things to help the nervous system, the B vitamins, and then you want to build up the muscle so that as the nerve input decreases, you have as much muscle, because if you let the muscle atrophy and the nerve atrophy, then you lose them a lot faster. So exercise is a big thing there.
That makes sense. Yeah. Okay. Next question is someone was just asking, how often should you be using a tuning fork?
You can't. I've never overdone it, and if I treat a dog and it takes half an hour, I'm done. Right. So if you want it to be comfortable, I wouldn't spend an hour and a half on your dog. Right. If it's going to be more than 30 minutes, I would say do what you've done and come back another day. Right.
Should it be every day of the week if it's a sore spot?
So usually what happens is you clear the problem, and unless the problem comes back, it's done.
Oh.
Right. So I clear my lymphatics, and it's a week later, it's great. A month later, it's great. I go for a flight, and that messes up your lymphatics, and I'm sticky icky again. But the first time may have taken me 20 minutes to clear all my lymphatics, and now I can do it in 2 or 3 minutes because I've gotten rid of most of it. Right. If you have scar tissue and you get rid of most of it, but then you have an instability where it starts to come back. Right. But how do you know? Because it's a diagnostic tool as well as a therapeutic tool. If it's not sticky icky, it's not a problem.
Right.
So right? I'm assuming your course would be teaching all these different things, but just as a baseline, then how would you know to use your tuning fork? Because would you just do a check on your dog to see if there's any sticky icky?
We teach you where to check. We teach you how to stretch them, where to find the trigger points, all of that.
Right. Okay, I see.
Okay. I saw one of the other question was you talked about cancer earlier, but just saying where.
So I would not go over cancer. So today I did an evaluation on a St. Bernard who had a periostal osteosarcoma.
Okay.
Of the humerus. So the whole humerus was huge.
It's like a bone cancer.
Bone cancer. And he had swelling down his leg. I would love to be able to clear his lymphatics, and I'm terrified to do it. Right? Because if I'm increasing blood flow to an area that could potentially feed the tumor. Right. So he's actually going to have an amputation in a week and a half. When that limb is gone, then we're going to clear his lymphatics. And that will help him and hopefully decrease metastasis and all of that stuff. But you don't want to do it anywhere where you could be increasing blood flow, because the fascia gets sticky icky around the blood vessels. So you have less blood flow to the area. Right. So if you open that up, you don't want to feed the tumor. So if your dog has shoulder cancer and you want to treat his knee, no problem at all. Just don't go on or very close to the tumor itself.
Yeah. And if you have any questions about it, just go to a vet for some further help.
Yeah.
Okay. And what course should they start with?
What?
It says, what course should we start with? Someone asked that.
So if you want to start with the tuning fork, it's called Tuning Into Your Dog. Okay. If you're I want to know all about fascia, it has 5 minutes on the tuning fork, but it also goes through information on instrument assisted manual therapy. It talks about taping and dry needling and fascia in general and stuff like that. And that's fascinating fascia for pet parents.
That's fascinating fascia. That's a great title.
Thank you.
That's a good one. Yeah, we can link that directly in the bio below. So we can do that after this.
It looks like, Eliza, we're going to have to wrap up soon.
I think so. I'm hitting my limit, I think. And also, we've gone through most of the questions I wrote down. There's plenty more in the chat, but for now, I think that can be enough for today, and we'll do hopefully a part 2 for everyone else who still has questions and wants to learn more. this is a fascinating topic, and I find it so interesting hearing how it applies to like humans as well as dogs. Like that's very cool.
It's so cool.
Yeah. So thank you to everybody who has watched for this whole time, or if you joined halfway through, thank you for being here. And thank you very much, Dr. Laurie, for being here today and joining us on this channel. We will, oh, sorry.
I said, thank you for having me. I love it.
Yeah, that's awesome. We're really happy you're here. That's great.
Very happy. I, for one, am happy. Okay. I'm not just asking the questions to Dr. Jones, but he has someone to talk to.
Yes.
But yes, we will link everything that we do have the store, Optimum Pet Vitality, and Dr. Laurie's YouTube linked in the bio below, but we'll also include some of the other links that we've talked about, like to that course you were just mentioning. And the code for 10% off is also in the description. And otherwise, I think that will be everything. So thank you so much to everyone. And
thank you.
Guys, have anything you'd like to say before I end this?
No, this is great. Thank you. I went through the course and I found it very helpful. And I'm going to be using some of it. So I can give it a 5 thumbs up.
Yay. Thank you so much.
Okay, I'm going to end the stream right now. So goodbye, everybody. Okay. See you in the next one.
Bye, Eliza. Bye, Laurie.